Is proudly brought to you by Sunseeker Stores. Memories of our tours are forever. Sunseeker Stores making priceless memories. And Luca Health Medical Specialty Center for moments that matter the most. You all know that October is about Breast Cancer Awareness Month, and as a show that is dedicated to women, we have to talk. We are dedicating tonight to talking about breast cancer awareness, and all the things you need to know. Before we get started on the show, we have a lady who has survived breast cancer. Her name is Eugenia Asari. She'll be sharing her story with us, how she was diagnosed, everything that she went through, and where she is right now. So let's see if we have Eugenia on the line. Well, before we get Eugenia on the line, we have a special person in the studio to have the conversation with us. She's a general practitioner doctor at Luca Health Medical Center. Her name is Dr. Joyce Emefa Adukla. Welcome, Doc, to the show. How has your week been with everything? She's looking really beautiful. Like, if you're listening to us on radio, you should check us out on Facebook Live. Doc is really looking beautiful in her pink. Doc, how's the breast cancer awareness month going so far?
So far, so good. I mean, we've been on air, we've been creating awareness and talking to people. And with the increase in awareness, we've had so many lots of people coming to do the free breast cancer. And I'm happy to say it's going very well. People are getting aware by the day.
Okay.
And then they come in at their spare time during work hours.
So
just to get screened.
Yeah, so it means that all the talkings that we're doing about people getting checked is making impact. Yeah. And we hope that the conversation we have tonight makes impact so that you can go to Luca Health and get checked. We're going to go for a quick commercial break. When we come back, we'll get into the conversation. Stick and stay.
Today, we discuss breast screening. Screening is a tool used by health professionals to examine the breast to detect cancer before the onset of any signs or symptoms. Screening offers a means of early detection of breast cancer so you can be promptly treated. The 5-year survival rate for breast cancer once detected early is 99%. Women of all ages can undergo screening, not forgetting our men, because about 1% of men develop breast cancer too. At your appointment, you will be registered and given a short breast talk. You will also be taught how to do a self-examination of the breast. Afterwards, your breast will be examined by a health worker in a comfortable, private and safe environment. If any lumps are identified, you will be asked to do an ultrasound or mammogram depending on your age. If there are no lesions, you will be encouraged to continue self-examination at home.
Hello and welcome back. This is Strong and Sassy on Joy 99.7 FM. Tonight we're talking about breast cancer awareness, and we have a lady on the phone. Her name is Eugenia Asari. She's a breast cancer survivor, a strong and sassy lady, and she's going to share her story with us. Hello, Eugenia.
Hello.
How are you?
I'm fine. How are you too?
I'm fine, thank you. So let's get into your story. I want to know in what year did you get diagnosed with breast cancer?
2018.
2018. Okay.
Yes.
Now, before the diagnosis, right? What happened? I mean, was it just a regular day? What happened? Walk us through your story.
Yeah, it was just a regular day, but I used to get a severe headache, so I was transferred to surgical. So at that place, I was to see my doctor. When that day too was a breast cancer awareness, so a nurse came to stand and then talk about breast cancer. So they are having the screening in the last room. Since morning, it's been talking and talking. I was just sitting there. So it took a while. Let's say getting to afternoon, around 12 p.m. Then I went to the room and I told him I've come to do the screening. And she said, okay. So she prepared me and then I lie down and then we started the examination. So as she was doing it, she was talking to me and asking me whether I know much about breast cancer. I said, no, I don't know much. I hear it. but I don't know much about it. Then she said, there's a lamp here. Do you know? And I said, yes, there's a lamp there. And she asked, how come or when did I realize I had a lamp? And I told her after breastfeeding. After breastfeeding, I realized there's a lump in my breast. And she said, okay. So immediately she called the doctor for an appointment, to book me for an appointment. So it was the following day, which was a Wednesday. So I came early to see the doctor. And the doctor to examine, and he said, there's a lump there. But for us to see what's the lump doing or what is it causing anything, then we have to do a true cut biopsy. Yeah, so that's how it started.
Okay, so after the biopsy, how many days time, or did they just tell you at once? How was the news breaking to you?
After the biopsy, I didn't go for the results early. As I said, I was so ignorant about it, so I didn't know much about the breast cancer or anything. So it took a while before. So months passed, and then we were in the next year, 2019, and it was on my birthday too. So my birthday was supposed to be on a Saturday, 6th July, and then the Wednesday I was going to Accra to buy some few things. I've already paid for the event and everything. So I was just preparing, and I had a call that, Madam, please kindly pick your results. It's been ready for a long time, so I should pick it up. And I picked it. So I said, okay, immediately I had the call. I began to feel something. My system came down. I don't know, like a feeling cold. So then I began to fight with my instinct alone. Let me finish the birthday before I go for the results. And then the other one too was telling me, go for the results now. So the now one was fighting me, which I wasn't so happy about it. Then I had already let a friend meet me in Accra, so she was waiting for me. So as I sat in the car going, I paid for Accra fare, but all of a sudden I dropped at 37 to go for the results. So I went for the results, and I gave it to the doctor. And the doctor said, then he was, he had a student around the same time, and then attending to patients too. So when he opened it, he began to talk, say certain things. And he asked me, do you understand? And I said, no, I didn't hear what you said. And he said, okay, you calm down. So all I'm trying to say is that the lump shows cancerous, but it is early stage, grade 2. So there's a lot we can do. You'll be okay.
Wow.
Then I said, breast cancer. He said, yes. Then I began to cry. He said, oh, no, don't cry. So I wiped my tears, and he said I should wait for him for a while, and then he came to write it. So he said, we are starting the treatment now.
Okay.
I asked him, now in like today or tomorrow. And he said, today you go and buy the things, and then tomorrow come and start the chemo. And I said, wow. So he wrote the labs for me to go to the lab and then do labs before I go and buy the medicine for the chemo.
So you were on your way to Accra. You were planning your birthday party.
Yes.
And then you get a call. You go to the hospital. You have breast cancer.
Yes.
Did you ever have the birthday party?
At the lab, then it began to hit me, breast cancer. I Googled and I saw pictures, and I was like, wow. That was when I realized that, no, everything had calmed down. I cried there, loud. People were just looking at me. Then I turned my face to the wall. I cried for about 5 minutes continuously. I was so much in pain. So when I got the courage to wipe my tears, I picked my phone. And then I called my sister. Doctor says I have breast cancer, so I have to start treatment now. So I sent messages to the friends, all those that are sent birthday cards to. Circumstances beyond my control, a party has been called off. Immediately, I begin to have messages. Why? What is happening? Do you need money? You don't have money. You want to do party. I didn't even mind them. So I mistakenly put it on the family platform. My mom too is there. Okay. So then she called me and I hung up. And I called my sister to call my mother.
Yeah.
To tell her that I'll call her back. I don't know, but my mother began to feel something because I told her I was going for the result before the party. Yeah. So I cried. I cried.
We cannot even begin to imagine that day. Now, you said the doctor said you had to start chemo immediately.
Yes.
How did that affect your quality of life, your family, work?
Yeah, it affected me badly. You know, chemo is a very deadly, or it's a very bad treatment that's been given to any cancer patient. I don't know about chemo. I don't know how it is. So I bought the medicines and I brought them the following day. Then they took me to a room and then began to pierce my hand to put in drip and stuff. I thought chemo is like they will put you into a machine or something.
Okay.
Chemo is just a drip.
Okay.
Yeah. It's a drip. Yeah, but we have the varieties.
Okay.
Yeah. So that was how I started the chemo. The first day, there's the one that the nurse says they call it burning sensational. It has a name, but they've given it that name. It burns. So when they push it, it burns like fire through the vein. So we have about 4 syringes that we are going to push.
Oh.
Yes. So the first time it was a bit okay. The second. So you can imagine from the 10th, 11th going, I can't bear it. It's so painful.
Was there a time you wanted to give up on the treatment and just go like, you know what, this?
Yes. Because when I go and come back, the way I feel, my stomach, I feel like vomiting. I feel like I want to stand up. At the same time, I want to sit. No, I'll lie down. My stomach. No, I take off all my dress. No, if I can open my stomach, I would have opened it. The feeling is very bad. So the first cycle I did, I have to do 6. The second, the third, the fourth, I begin to lose my hair, my eyelash, my bra, my pubic hair, my armpit, all the hair, my skin, everything. I was sakura begins to go off gradually. So the 5th one. So the 5th cycle that I did.
Yeah.
Then it was time to go for the 6th one. After the 5th one, I began to have this strong feeling that if I do the 6th one, I'll die.
Wow.
So I began to tell my mother, I'll not do the last one. My mother said, you'll kill me. My mom called my uncle. They should talk to me to do the 6th one. My uncle called. I said, you went, after saying what he has to say, so do you understand? I said, no. So my uncle says that, in fact, I've made up my mind. They can't force me. So my mom took me to the doctor. And then still, I told the doctor I won't do it.
Okay.
Because I have the feeling I'll die. So a week to the 6th one, the dress, the syringe, the whatever, all that I have here in the room, sorry, I tie it in a rubber and then put it in a dustbin.
Why?
Because the feeling was that when I do it, I'll die.
Okay, so you were preparing.
And the moment I put it in the dustbin and then I walked from outside to the room, I was so okay.
Okay.
I felt very good, and then I don't know. So immediately I called my mom that I am okay. She said, what happened? I said, I've threw all the things away. She didn't utter a word. So the sixth cycle, I didn't do it because the feeling was so much that if I do it, I'll die.
Okay.
Yeah.
So what happened after that?
So after the
You didn't do the sixth
fifth one,
Mm-hmm.
then I had a surgery.
Okay.
Yes. Then that was when they took the lump off from the breast.
Okay.
Yes.
So how supportive was your family during this? Did you get any stigma from anybody for having breast cancer, or were they really supportive of your journey?
No, my family, they were very supportive.
Okay.
My family and a few friends who knew about the issue. My family, I thank them so much. I thank God I have such a wonderful family.
Yeah.
My sister Sabina, my last born Catherine, even my brother, my mom, my prayer warrior. You know, they were so supportive. My cousins. I had after the chemo,
Yeah.
after the chemo, and then after the surgery.
Yeah.
In December, I fell sick. Seriously, I paralyzed.
Oh wow.
I was admitted. Initially, they thought it was malaria, but there was no malaria. They thought it was typhoid. Nothing. They did series of tests. They couldn't find anything. So I was at the emergency for 3 weeks.
Wow.
I was paralyzed. I can't move. I can only move my head left and right. I can't move my hand. If I want to wee, they have to hold me. If I want to drink, I have to call nurse. I want to drink water. There's a straw in the bottle water. Then I sip.
Okay, Eugenia, Doc wants to ask you a question before we continue. Doc, you had a question for her.
Yeah, I'm so sorry about your experience, Eugenia. That must have been a harrowing experience. I just want to know if you had other people on board while you were having your treatment, like a clinical psychologist you could speak to, because the treatment tends to be multidisciplinary, meaning it's not just the doctors and then the nurses. We have other people, you know, other professionals coming, counsel you if need be. That's for the side of the clinical psychologist, even depending on your faith. You know,
somebody to
if
help
it's a
you.
priest, to help you spiritually too. So I just want to know, while going through your journey, did you have any, because mostly it's multidisciplinary, so we have people from other professions also coming. Did you have any such support spiritually, psychologically? You spoke to a clinical psychologist along the line?
I only had my spiritual father, Dr. Michael Brady Nyameche. He was praying for me. But aside that, for the clinical aspect, like having an expert counseling me, and no. I did everything by myself. I took things cool.
You're
Yes.
such a strong woman.
I trusted. I told the doctor that I don't know anything about it. If I die, I die for you. If I live for you. So please, I beg you, treat me like your own daughter.
Yeah.
So there are times you're going to have difficulties with me. Like before, I said I'll not do the chemo.
Yeah.
So please, I beg you. Please. So he is a person. Anytime I listen to him, I feel okay. He does the counseling. He talks to me.
Exactly.
That calm down. When you do this, you'll be okay.
Yeah.
In my diet, I should eat this. So apart from him, and then my spiritual father, had no one.
Yeah.
These two people.
Eugenia, I just want to know, we hear a lot of people abandon treatment because of the cost involved. How did you manage all that?
Yeah, it got to a point. I was in bed and I began to cry because my sister is suffering. She told me, Junior, I have to do 2 work, make additional 2 work to get extra money to pay for your chemo or for other things. So I said no. Then my church, student union, I called the chairman. I told him. I told my SS people. They helped me.
Yeah.
And then I work at airport.
Okay.
a security agent to British Airways.
Okay.
That year too was the first time they were doing contribution, there's voluntary contribution from the passengers who are traveling.
Oh, okay.
Uh-huh. So I told my friend about the issue.
Yeah, and they also
Just
chipped in.
my colleague. So I just
Yeah.
told her. I was home one day and then she called that way. She had told the madam, Delta, that Eugenia, I need money for this. So the money they had, they gave it to me.
Wow.
And then I went out. I mean, I wake up in the morning, I dress, I tie my hair, and I begin to walk out, go to company. Good afternoon. Please, I want to see the HR. Do you have an appointment? I say, no, you can't meet. I beg. Those who allow me to meet, they will allow me.
Yeah.
If they don't allow me to meet their boss, I go out.
So you went
I
on a
go to
thank you
beg
tour.
companies, I beg. I beg. I went to companies. I went to Tobinco. I met the man.
Wow.
I couldn't talk to the man. I went to a lot of companies
Wow.
begging for people to support me.
Wow.
Some gave me. I had the money. Some gave me. Some too. They see, the people were judging me by my look. That is my problem. You see, I can't. I am a young lady.
Yeah.
Who is working that I know what's up. You understand?
Yeah.
So when I dress and I go out, you look too beautiful to be sick. That was what one man told me. You look too beautiful to tell me you have this sickness. I don't think it's not like I told him I don't know how to explain myself, but I can't go further. Yes. People were doubting me. When they see me going, they doubt me. But I am walking with a big sore under my breast. I am walking, my hair all is red off. I am walking, and then I'm just walking. I don't see how they see me, but they asked for. I went to people. I went to these political parties, and then
Eugenia,
it was. Yes.
Can you hear me?
Yes, please.
So, like you're saying, so it's quite the cost involved in the treatment
Very
is
expensive.
very expensive.
Very, very expensive.
I mean, we are so grateful to you that you were able to share your story with us. And finally, before you go, are you totally free from breast cancer now?
Yes. The last result that came out, my doctor told me, now you are cancer free, but it doesn't end there.
We are so grateful to God for your life.
Thank you.
We're so grateful to God for your life, and we are so blessed that you were able to share your story with us. And we hope and know that anybody that is listening to us tonight, you've heard Eugenia's story. Then that's why Doc is also here. We're going to have the conversation. There's so many avenues going on this month. Hospitals are offering free screening. Luca Health is doing that. You need to go and get tested. Well, before we continue the conversation, thank you so much, Eugenia, for sharing your story with us. Thank you so much. Now we'll come back into the studio. Doc, how did that story make you feel? Oh my God.
When I heard about the birthday party
and
then the preparation, I was like, that's such an anticlimax,
Oh.
to be preparing for a party and to be hit by this news. That's quite sad.
If any hospital calls me, I am having my party and I'll come for the results later. I am not going to have my party ruined. Now, Doc, let's get into the conversation. She said the stage that she was grade 2 or stage 2, are they the same things?
It's stage 2.
It's stage 2. What does that mean, and is that early enough?
Okay, so when we talk about staging in breast cancer, we'll talk about like detecting and all that. But when we talk about staging in breast cancer, it's usually helps in the treatment, because the treatment modality is based on the staging.
That you are.
Yes.
Okay.
So we have 5 stages. So stage 0, which is we usually use that to describe the non-invasive. In medical terms, we call it non-invasive ductal carcinoma in situ. is a mouthful. Yeah, so non-invasive. You just take it like that. And then stage 1 to 4 is what we use to describe the invasive breast cancer.
Okay.
Yeah, so stage 0 is like very early. So stage 1 to 4 is what we use to describe. So in all, you have 5 stages. So she being at stage 2 just meant that the cancer, the lump size was more than 2 centimeters, but then less than 5 centimeters. So it's just like the tumor stage, and these are like very technical terms. So basically, what the staging does is it determines the treatment you
stage
get.
2 treatment in Pony.
But stage 4 is worse, hence our conversation for the month, because I always tell people, if you want to wait till you have symptoms, it may be too late.
Okay, let's start the conversation now. Breast is supposed to be normal, right? Like, what does a normal breast look like? Because we all know that early detection is everything. So we'll start from the basics. What is a normal breast supposed to look like? What is it supposed to feel like?
Okay. So a normal breast for everybody, I wish I could describe this in graphics. I mean, you have the breast tissue.
Yes.
And then you have a nipple, and of course there are different shapes and sizes when it comes to breast.
Okay.
So you have large, you have very small breast, you have very large breast.
Yes.
Yes. So it's different for every individual. Yes. So I always say that if you examine your breast every time after your menses, you get to know what the normal is.
Okay.
And then when something changes about the breast, you are able to see, because it's like placing something in your room, you know just how it's arranged. Definitely, if there's a difference, you'll be able to tell.
Okay. Yeah. I mean, if you're a man and you're listening to this show, men also get breast cancer.
Oh, yes.
So
a study in the UK actually revealed like 1%, though it's not too common, but men, you see, the risk is, so it brings us to the risk factors. Once you have breast, you can't get breast cancer. So they have
once
been men,
you have breast,
you have
breast. Don't say it's chest. It's breast.
Just that it's just about 1%
of that
per UK study. Yeah.
So you've told us how, and you should be checking your breast often, so you know what normal looks like. Now, what is a normal breast? What kind of signs, symptoms, feeling should make you say, this breast, there's something wrong with it, I need to go get checked?
Okay. So first of all, a lump.
Just something as simple as
a lump. Something as simple as a lump. And then you have skin changes of the breast. You know, what your normal skin is supposed to look like. So skin changes, we have what we call the peau d'orange appearance. So it's like the peel of an orange. That's
orange. French.
Yes. So you see how you have holes in that. So that is how it appears like. And then sometimes you have like reddening of the skin around the breast, or you have like scaling. You know, you see when you have dry skin. Yes. So sometimes it can be as subtle as just having scaling of the breast. Also, usually you wouldn't have any discharge coming out of your breast nipple, unless of course you are breastfeeding. But any nipple discharge, bloody nipple discharge, is actually cause for concern. Yes.
So let's just be clear, does all of those things mean that it can be breast cancer? Maybe it's an ant that beat you whilst you were asleep.
That is why,
so that we don't have people start.
That is why there's always clinical assessment. So we advise that you do all this, but when you come to the hospital, we don't just use that and then draw a conclusion. Actually, to stage cancer, we have what we call the triple assessment. So it is the clinical assessment, the clinical exam. So we take a history from you and try to, get the chronology of events. And then we have the imaging part, which is the radiology. So mammogram when you're above 40, and then below 40, we do the ultrasound, ultrasound scan. And then we have the pathology, so histology, cytology. So we do the triple assessment to be able to help in the staging. So it's not just about you can have a lump in the breast, but it could be benign. Benign meaning it's not cancerous. You know. Yeah. So it's not every lump in the breast that is automatically conscious.
Yes. Well, Strong and Sassy is brought to us by Sunseeker Stores. Memories of our tours are forever. Sunseeker Stores, making priceless memories. And Luca Health Medical Specialty Center for moments that matter the most. And Luca Health has some breast cancer tips for us. We'll get into that, then we'll get into some questions. Not all findings are cancerous, like doctor said, but knowing early is key. Not all changes and findings in the breast are cancerous. There are some benign breast condition which also occur. These conditions also need to be treated before they cause other problems. Ensuring that you are reporting any changes you observe to your healthcare provider for further diagnosis. Look out for lumps, nipple discharges, discoloration, reddening, and any other unusual symptoms. Your doctor will explain any findings or questions you may have. This awareness tip is brought to us by Luca Health Medical Specialty Center in East Legon. It's a really, really nice hospital. You know those hospitals that when you just go, enter, you start feeling better already. That's Luca. Now, let's talk about the risk factors. What things increases my chance of having breast cancer?
So I always say everybody is related to a woman one way or the other. You either have a sister or you have a mother or you have an auntie. We're born of a woman.
Okay.
So first of all, being a woman.
Just by being a woman.
And then having breast.
Okay.
So being a woman, having breast is both of them are major risk factors.
Yes.
And then we come to the technicalities. So we talk about what we call nulliparity. That's if you've never had a baby before.
Okay.
So why that comes in most of the time is, okay, so let me talk about early menarche and then late menopause. So early menarche simply means you had your menses, your first menses, quite early in life.
Okay. How early is early?
Some people menstruate as early as 10 years. And then when you have late menopause.
Okay.
So what happens is it's all about the hormone estrogen.
Okay.
And so what happens when you start menstruating early and then you have a late menopause, you have an exposure to the estrogen hormone for several years.
Okay.
And this is usually interrupted by maybe pregnancy or maybe if it's interrupted surgical. People have hysterectomy sometimes along the way, depending on if you have a medical condition that requires that you have your womb taken out. Yes, but the estrogen exposure is the problem. So what happens is if you get pregnant, your estrogen is interrupted.
So
because
getting
pregnancy hormones take over. So getting pregnant is actually protective. And getting pregnant early enough is actually very protective.
I don't know how I feel about this news, considering how I feel about pregnancy and babies. But
getting pregnant early
actually
enough,
helps.
yes, because you have an interruption in the hormone estrogen, and so you have pregnancy hormones take over.
Okay.
And so that's where the nulliparity comes in. So the having an early menarche, which is the age of your first menstruation, is actually a risk factor if it's early, and then late menopause. And then also, so we're talking about early menarche, and then we're speaking about late menopause. And then if you have a family history of breast cancer, so in a family, you realize that a mother has had breast cancer, then a sister, then an aunt, So we tend to ask all those questions when it comes to the hospital. Have you ever had... People sometimes think when doctors ask them questions is because we just want to chat.
Yeah, making small talk.
We take information from all these things. So asking you whether you've had a family history of breast cancer, we are better able to, make predictions.
So we need to be asking our mothers, our aunties, if anybody in the family has had breast cancer
before. So that's actually also a risk factor. So the age at which you have your first child, having your first child after the age of 30 actually poses...
I feel like all this is going up against me. So the age at which you have your first child,
that is not to say definitely you're going to have breast cancer if you have your first baby after, but like I said, it's all about the hormone estrogen. So, and then also we talk about we talk about obesity.
Okay.
So physical inactivity, so your weight gain. uncontrolled weight gain, meaning you're not living a healthy lifestyle.
Lifestyle.
You are indulging in all the, negatives. So alcohol, smoking, they are all risk factors. Smoking and alcohol tend to be in, across board. But actually, it's written on the smoking pack. It
I
contains
know.
carcinogens. So you're actually forewarned, but people still indulge in smoking. So so they are all risk factors. So early menarche, early menses, late menopause, being a woman, number one, having breast, then early menses, the time of the time of your early menses, and then late menopause, which means you have
a long time,
estrogen exposure, and then the age at which you have your first child after 30 usually poses a risk. And then if you've never had a child before, nulliparity, it means there has been no interruption in your estrogen.
So the estrogen level is...
Exactly. And then we also encourage exclusive breastfeeding. So breastfeeding is actually protective, because what happens is in there too, we have, an interruption in the in exposure to estrogen. Because prolactin is the hormone that is responsible for milk production. So once you are breastfeeding, your prolactin levels are high, and breastfeeding is actually a natural means of contraception. If you are breastfeeding well and your prolactin hormone is high, it actually suppresses ovulation.
So wait, if you're breastfeeding, you can get pregnant?
No, that is not to say it's sometimes. So if you are not doing it well, of course there have been people who have been breastfeeding their babies and then still gotten pregnant along the line. So we always hammer on exclusive breastfeeding. So breastfeeding and breastfeeding well.
I'm just going to say something, but we'll get into that later. Now, how is breast cancer diagnosed? I mean, we talked about the science, so just to make sure that people don't be like, I have a lump, and then they will self-diagnose.
Okay.
Do you have to go to the hospital and get a test done, do the mammogram it is?
So I've already spoken about the triple assessment.
Yes.
So that's the clinical examination. So that's coming to the hospital and then we asking you questions and examining, taking a history and then all that. Then the next stage is the radiology, which is the imaging. So I've already spoken about mammogram above 40 and then below 40 we use the ultrasound. That's because when you are younger, your breast cells are not well differentiated. So if you do a mammogram, if there's a cancerous lesion, it'll be hidden, so won't see well. As you grow, your breast is replaced more by fat.
Really?
Yes.
Okay.
As you grow, as you are young, it's full of
full flesh,
fibroglandular tissue. Yes. So if you do a mammogram at a young age, you may not see anything. So above 40 we tend to do the mammogram.
Okay. And then below 40
we do ultrasound scan.
Okay.
Yes.
Okay.
Yes. So that's it. And then the next stage, the third, is the pathology. So we do histology and then cytology. But this is for the clinic. Our emphasis or our focus for the month of October is the self-breast exam, which we are encouraging everyone to do at home. So this is, every month after your menses, because note that before you menstruate, the premenstrual symptoms, you have heaviness in your breast, painful breast. Sometimes your breast even feels lumpier than it usually is. So that wouldn't be a good time. So
let's pause, because I don't want people to miss this information.
Exactly.
What time do you check your breast?
Okay.
Because the cycle is quite funny. So there's the menstruation, then after that comes ovulation, then there's a free period kind of then there's the premenstrual cycle, then menstruation. So at what time is your breast free for you to examine?
So typically we give a week after your menses. And menstruation, the first day that you bleed is day 1 of your cycle.
Yes.
So after bleeding, you give yourself about a week.
Okay.
And then you can, by then it's assumed that your breast has returned to its
normal state.
Exactly.
Okay.
And so I know someone out there may ask, what if I'm not menstruating? What if my uterus has been taken out, so I'm not menstruating? So you choose a date in the month, if it's the middle of the month or the end of the month, and then stick to it. And so you do that every month.
Okay. Now, walk us through the breast examination. Where do I start from?
Okay.
Too bad we don't have any visuals here, but walk us through. So just close your eyes and imagine your breast, then walk us through it.
Okay. So in order not to make it sound or look too cumbersome, it can be as simple as when you're in the bathroom having a bath.
Okay.
It doesn't have to be all, oh, I have to get a bed and lie on it. No, so it can be as simple as after having a bath, when you after taking a shower, when you still have water on you, your skin is when you have soap on you. And the aim is to examine. So okay, so let's take it this way. You always use the flats. I'm going to try as much as possible so those listening can imagine.
It,
so we usually tend to use the flat of our palm, so the fingers from this side.
Okay.
Yes, and not the tip. Not the tip. So you don't go pressing your breast with the tip of your fingers.
So
use
your flat
the
palm.
flat, exactly.
Okay.
Exactly. So
And
you don't go and you don't hold your breast from top to down. If you do that, you will definitely feel a lump, because mind you, the breast has its tissue. We call it fibroglandular tissue.
Okay.
So the breast has its tissue, and if you hold the breast from top to down, you will definitely feel a lump.
And just
so with this, our aim is using your chest wall as a board, and then you press your breast tissue with the flat of your palm.
So this way.
Exactly, against your chest wall. So the first thing to notice, you don't hold it. You use the flat of your palm to press your breast tissue against your chest. And then you always pick a point on your breast. So imagine like the face of a clock.
Okay.
So you always pick a point on your breast. So your breast, you imagine it like the face of the clock, and then always know that where you start from, you either go in a clockwise or a circular motion. So either clockwise or anti-clockwise, and then just make sure where you start from, you go and then end there, so you don't miss any.
So you don't get confused.
Exactly.
Okay.
So you just note where you start from. You go round, and then you end there. Okay. And then doesn't end there. When you go around and you end, then you come to the nipple area as well, because there can be something hidden behind the nipple too. All right, so you examine. So all this is with the flat of your palm, and then press against your chest wall. You go around, then you come to your nipple area. Then afterwards, you press your nipple to see if there will be any discharge. So you are looking out for bloody nipple discharge or any other discharge. Then also note that your breast tissue is not just the breast that you see. It goes all the way into your armpits. And true. Also, yes, it also comes a little above the breast, almost like you are going towards the base of your neck. Exactly.
Okay.
Exactly.
You have to check all these.
Yes. And then under your armpits, you are basically looking for what I would call bead-like lesions. We call them lymph nodes.
Okay.
They are so usually if you have, lymph nodes under your armpits, they are like swellings.
Okay.
And imagine them like beads. If you have them under your armpits, then it means there's something going on in your breast.
Wow.
Yes.
Self-breast examination is important. If you can't examine yourself and you have a partner, let your partner help you examine your breast. We are going for a quick commercial break. We'll be right back. Welcome back. This is Strong and Sassy on Joy 99.7 FM. And Strong and Sassy is proudly brought to you by Sassy Stores. Memories of our tours are forever. Sassy Stores, making priceless memories, and also Luca Health Medical Specialty Center for moments that matter the most. This October, treat your family to the gift of wellness. Did you know that annual checks and health screenings save lives? It does. Do you need a reliable health partner for your family's wellness checks? Like I told you, look no further. Luca Health is here to serve all your family healthcare needs. Luca Health Medical Center offers world-class, top-quality medical care right here in Accra. We have custom health and wellness packages at affordable rates for your whole family. Find Luca Health in East Legon behind Mensvik Hotel, or call them on 0544 120 777 to book your wellness appointment. Luca Health, for moments that matter the most. And like I said earlier, Luca Health is one of those places that when you just walk in, you're okay. You're okay. The Holy Land Tour, our pilgrimage to Israel, is more than just a vacation, but a spiritual, life-changing and emotional experience for many who embark on this once-in-a-lifetime journey. This December, join the Strong and Sassy team from the 2nd to the 8th to relieve the verses of the Bible, giving you a whole new understanding of the lifetime of Jesus. And I am looking forward to this trip because I was born on Christmas Day. So me and Jesus, we're going to go have a good time in Israel, okay? This package will include 5 nights in 4-star hotels, daily meals, transport in deluxe coaches with free Wi-Fi, English-speaking guide, visa assistant, and so much more. The highlights include Mount of Olives, Garden of Gethsemane, the Church of the Holy the Valley of the Wall, or what they call the Wailing Wall. In fact, all these places, just look through your Bible, you see them. The Jordan River, the Mountain of Beatitudes and Sea of Galilee, the Dead Sea, ancient Jaffa, the city of Nazareth. You get all of the above for $3,668 per person sharing, and $4,283 per person in single occupancy payable in Ghana cedis. So join me and the team, Strong and Sassy, as we walk in the footprints of Jesus. Call Sassy Stores on 020-2044-103, 020-2044-102. Strong and Sassy is brought to you by Sassy Stores and Luca Health Medical Specialty Center. Doc, Breast Cancer Awareness Month. Now, you know what I wanted to talk about? There's so many myths. And before we came into the studio, I told you about my breast cancer scare story. It was not funny at all. I thought I was about to die. So I want us to quickly run through some myths. So I'll say some things and you tell me if it's true or false now. People say wearing braces can cause breast cancer.
Wearing what?
Braces. As women, as we're supposed to be, the things you find on the internet is ridiculous.
Usually as doctors or as medical practitioners, we work with evidence.
Okay.
Our job is evidence based, and I haven't come across any.
So why do we have the whole free the breast thing?
Oh no, it's just to create awareness.
Okay.
Of course, you are not supposed to keep your breast in bra 24/7. At night, you are supposed to free
Let
the breast. Yes.
Free. Okay. Now the big one. You said breastfeeding, not breast sucking. Men sucking
I
breast
tend to get this all the
helps
time.
prevent breast cancer. True or false?
With that too, there's no scientific basis.
The
to
men in
it.
the studio are looking at me like, Eyram, why are you trying to pour sand in our gari?
there's no scientific basis. I mean, if you want to have your fun, you're allowed, but there's no scientific basis.
So
to
you
that.
are not a baby. You are not helping.
With the babies, there is breast milk, and like I said, with the milk comes prolactin, because prolactin is a hormone, and with prolactin production or secretion lowers estrogen,
So
or
it's
interrupts the estrogen
the breast
exposure to estrogen.
milk that's coming in
Exactly.
not you. The
Sucking
only thing
is a reflex. So the more the baby sucks, it stimulates, it tells the master gland that, hey, there's a baby there. And then it secretes more prolactin. Yes.
So not big babies. If you want to help your partner, use the flat part of your hand.
But actually it's significant, because there have been cases where it is the partners who have found that because it's yours, you handle it. And so it's the same as the self-breast exam we are talking about. If you know the normal, if there's something unusual. So most people have had their partners telling them, I think there's something different about your breast. And then they decide to go check, and then boom.
The men are smiling. So what Doc is trying to say is that when you are sucking the breast, suck it with medical intentions in your mind. Like when you're holding the breast, be examining it and sucking accordingly.
You are used to the breast of your wife, and so if something changes about it, you definitely know. Yes.
Okay, men, keep doing what you're doing. Family planning, can that cause breast cancer?
So it's actually OCPs, to be precise.
What
the
is it?
oral contraceptive pills.
Okay.
Is actually a risk factor to having breast cancer. That's why we always tell you, before you take any medicine, you need to consult your doctor. So with that, there has been clinical evidence.
Only women get breast cancer.
No.
Okay.
Men can get breast cancer too.
Okay. Only women with a family history of breast cancer are at risk.
No, there have been people who have had no history of breast cancer but have had breast cancer.
Wow. Breast implants, they raise your increase. True or false?
That, and then hormonal therapy.
Okay.
Hormonal therapy.
What is a hormonal therapy?
Sometimes, during menopause, some people have to undergo like hormone
treatment.
and
Okay.
then all that. Yeah,
Okay, I mean, I asked this, but and I think that's when you differentiated between the time you should get a mammogram. That
Exactly.
mammogram increase your risk factor in any way.
So mammogram is actually, we use as low dose radiation.
Okay.
Of course, to everything there's a side effect. So repeated exposure to radiation can actually cause cancer. But in this case, the benefits outweighs the risk. That's why you don't just go exposing your breast to radiation. Yeah.
And another one that I've heard quite a lot, they said antiperspirant, like deodorants and stuff like that.
Well, there actually have been studies, because antiperspirant, it means it prevents you from sweating. You are actually supposed to, you have sweat glands and the armpit, you're supposed to sweat. So antiperspirant, meaning it prevents you from sweating at all. So there have been some associations with using antiperspirant deodorants. I've read some papers on that.
Finally, can drinking coffee or too much coffee Doc is even laughing. I told you the internet has too many things.
So I know about alcohol.
So alcohol smoking.
And then I talked about lifestyle. So, people wait, and then when they have the cancer, that is when you see them using all sorts of things. I always say, when the disease is there, please go for treatment.
What are some preemptive lifestyle changes that people who are listening to the show can indulge into before, like, to prevent them?
So I talked about keeping your weight under check, because I talked about keeping your weight under check because obesity is a risk factor. So keep an active lifestyle, exercise as much as you can, eat healthy, your fruits and then your vegetables. Stay away from alcohol or in moderation, and then smoking as much as possible. Because smoking, the cigarettes actually contains carcinogens, which are cancer-causing agents.
Okay. We have a message from Nana Kwesi, and he says, thanks to the universe for her survival. And he's referring to Eugenia Asari. We thank God for her recovery. I get the feeling that if the patient do not have the resources to fund treatment, the story would be different. That is true. That's why we are insisting that you get tested. Get tested. There's so many facilities, hospitals doing all kinds of things. Luca is doing
Luca
one.
Health. We are offering, we have offers, so we are doing free breast screening throughout the month of October. So it's a walk-in, so you can walk in.
And Luca is in East Legon. Just walk in, have your breast examined for free, because early detection saves lives. Thank you so much, Doc, for coming.
Thank you,
My name
Eyram.
has been Noeli Eyram Yehouessi. We'll see you same time next week. It's bye for now.